Mayhew. Thank you very much, Mr. Chairman. And I congratulate my neighbour for securing this important debate about the health service in the east of England. We've just recovered from a general election. I hope we've all had a time off, a bit of a break to recharge our batteries and to start thinking about the way in which we should lead this country in the years and months ahead. Health and the health service was a key election issue on the doorsteps in Broadland and Fakenham. And as the Conservative candidate, I was armed with a whole series of data about how we had more doctors, 20,000 more doctors, we'd recruited more nurses, I think it was 50,000 more nurses. We'd paid for and secured more appointments for GPs, 50 million more appointments each year, to 350 million GP appointments per year. And we provided more funding, a lot more funding for the NHS. So we'd increased it by £28 billion, a 17% increase since 2019. And so I'd have a conversation on the doorstep saying, reading off all these facts about how we'd improved or funded the health service. But it didn't feel like that to our constituents. And it was a key negative impact for the Conservative candidates like myself. So you've got to ask yourself, why? Why is it when as a government we felt we'd done what we could, we'd improved, increased the numbers, increased the funding, and yet the outcomes that our constituents actually experienced did not tally up? Well, there are a number of factors that I've come up with. One was the COVID backlog for elective surgery. And that's something which was thrown at the government, obviously caught unawares back in the early part of 2020, and it created a huge backlog. Now, steps were taken to address it. In Norfolk, we have the new operating theatres, 2 new operating theatres at the Norfolk and Norwich for elective surgery. We've got the diagnostic centres at the James Paget and the QEH, and a new one at Cromer as well. But they take time to work through, and the election came before our constituents felt the benefits of that enormous local investment. But there was a bigger problem, and that is one that my government failed to address. I think it's a key proper criticism of our government, was that productivity in the health service went down between 2019 and 2024 by about 5.8%. So we're putting much more money in, we had more staff, and yet the outcome, what they were achieving, decreased. And if there's one thing that the Minister should be addressing, and I'd be very grateful if she could address this directly in her summing up, is what plans the government has to improve productivity, not just funding, not staffing, but productivity within the NHS, because that is the absolute key. And my starter for 10 is it won't be by having pay deals like that awarded to ASLEF, where money was provided and the productivity improvements were removed from the deal. Yes, I will give you.
I'm very grateful to give him away. He makes a really important point about productivity in the health system. Does he agree with me? And I've been a health minister, and I've observed that in the health system, not by ministerial diktat, just the way it works, if you deliver more for less, the Treasury and Department of Health give you less, and if you struggle to deliver more for less, we give you more. If you ran a business like that, you'd be bust. Does he agree with me that ultimately the East needs a much more decentralised, empowered system? In Norfolk, we have an ambulance trust, a mental health trust, 3 hospital trusts, we have 5 CCGs. This is bonkers. We need surely one Norfolk healthcare system that provides what patients need, an integrated patient pathway.
I'm very grateful for that intervention. We have got progress in this direction with the Integrated Care Board. I personally think it's a very good step in the right direction, because it allows Norfolk, the whole of the care system in Norfolk, to come under one remit. And we were beginning to see in my view, some of the benefits of that with the Mental Health Trust. So although it has got a long and pretty disgraceful history of underperformance, there are some tentative signs of improvement since the ICB has come into power. The next issue, particularly in Norfolk, was the physical state of our hospitals. So we have the Queen Elizabeth Hospital, the QEH at King's Lynn. It's a RAC hospital, the James Paget in Yarmouth, and then a pretty modern hospital, actually, the Norfolk and Norwich in Norwich. The last government fully funded, agreed full rebuilds of the QEH and the James Paget. They are long overdue, those rebuilds. They're going to be rebuilt by 2030. I am very, very concerned to hear that that funding commitment is now under review. And the Minister may be constrained in what she can say at the dispatch box, but whatever reassurance she can give the residents of Norfolk about the intention, at least, of the current government to continue those rebuilds, it would be very much appreciated, because they are enormously important to my constituents. And then there's dentistry. So the Honourable Member for Norwich South talked about the dental desert that we have in Norfolk. We have 39 dentists per 100,000 of the population, compared to a national average of 52. If you grow up in Norfolk and you want to be a dentist, the nearest place you can train is Birmingham or London. So it's not surprising that we don't have domestic, homegrown talent coming up and being dentists in Norfolk. And if you're a 26 or 7-year-old who's just qualified and you're not from the Eastern region, what incentive is there for you to move to a largely rural area? It's for those reasons that we desperately need a dental training, an undergraduate dental training school based out of the UEA in Norwich, but perhaps in partnership with other academic establishments in the East of England. I'm not squeamish about what it looks like, but we do need to have undergraduates being trained in the East of England and in Norwich, because we know from the medical school that we have at the UEA that about 40% of the graduates become sticky. They stay in the area because they fall in love, get married, and develop commercial relationships with GP surgeries and the like. So at the last government, we had the dental minister up at the UEA in about May, I think it was, for a lecture and a series of meetings. The impression given was that we were on the cusp of an announcement of a dental training school, but that the election came in the way. All of the Eastern Region Members of Parliament, irrespective of their colour, are wholly in support of this, and I would be very grateful if we could have some indication, as the Honourable Member for Norwich South said, that this is still on track. So there's a huge amount to be done in the East of England, and Norwich in particular, but we have great staff, we've got good structures, but we just need to get the productivity working. We need to get the expectation of early appointments with GPs back on schedule. One of the recurrent complaints I get from constituents is that how difficult it is to see a GP. I note that 43% of all GP appointments are now on the same day, and that is a record that needs to be built on. So I listed a number of areas where I'd be grateful if the Minister could give an indication. I look forward to hearing her response.
Yes,